Welcome, everyone, and thank you for joining us today. Imagine a world where preventable diseases no longer determine the fate of the communities, a world where every child can go to school without the burden of illness, and families can chat on a Sunday morning. This vision is at the heart of Healthyi. More than just a student-led organization, we are a movement motivated by compassion, determination, and the belief that access to healthcare is a fundamental right, not a privilege. Today, we're excited to take you on a journey through our work, stories of hope, resilience, and the power of community-driven change. My name is Ahyoung Chung, and together, let's explore how we, Healthyi, is turning this vision into reality. At Healthyi, we believe that real change happens when communities are empowered with both resources and knowledges. Our projects are designed to address entities through direct intervention and education. Today, I'll introduce two key initiatives. One focused on mass drug administration in Nigeria, and another on raising awareness in Rwanda. These efforts not only provided immediate effect, but also created the foundation for sustainable health improvements. Let's take a closer look at the impact of these projects. Let's begin with one of our significant projects, Nigeria Mass Drug Administration Activity. From August 28 to September 8, 2023, Healthyi collaborated with the Kaduna State Government and One Tribe Initiative to combat soil-transmitted helminthiasis, aka STH. Albendazole was distributed to 3,000 people, and healthcare workers and teachers received training to sustain the initiative. Along with conveying the medicines, they made project ban items such as t-shirts and banners, and trained the primary healthcare workers and school teachers, continuing to form plans. Next journey we'll see is the project that was done recently in the summer of 2024. We promoted our entity awareness campaign in the Hue district, Rwanda, with the collaboration of the Medical Students Association of Rwanda, aka Medasar. This project's aim was to combat bilharzia, educating about its prevention, symptoms, and treatments. Through this project, more people gain awareness of bilharzia, underscoring the importance of dealing with entities in vulnerable communities. Now let's take a look at the journals written by our journalist, Ahyoung Chung. These following reports aim to convey information that we've analyzed to combat entities effectively. Our reports analyze key challenges such as global elimination goals, the stigma surrounding entities, regional disease hotspots, and the impact of COVID-19 on treatment programs. By examining these insights, we could create better strategies and advocacies to fight against entities. According to the report titled Neglected Tropical Diseases, the ultimate goal that we are aiming to achieve SDG Target 3.3, eliminating entities by 2030 requires stronger accountability, cross-sector collaboration, and a shift in operational models. With sustained commitment, this goal is within reach. The next report is Neglected Tropical Diseases. How should we address stigmatization? This report highlights the need for a collective effort from all sectors of society to address the stigmatization of entities. Stigma remains a major barrier to entity control, and Healthyi tackles this by increasing awareness, integrating mental health support, and advocating for policy change. The next work is a report on uncovering entity hotspots, regional analysis of entities. According to this report, entities disproportionately affect low-income regions despite being preventable and treatable. While global efforts have reduced cases, 857 million people in Southeast Asia and 584 million in Africa still require interventions. Healthyi aims to close this gap through targeted campaigns and community-driven initiatives. Let's move on to our last work about interactions between COVID-19 and entities. The pandemic disrupted NTD treatment programs, halting mass drug administration and straining global supply chains. Countries like Guinea and Guyana adapted, resuming efforts despite challenges. Healthyi is committed to strengthening health resilience to prevent future setbacks. At Healthyi, we're learning from these challenges addressed in our reports. Our work in Nigeria and beyond focuses on building health programs that can withstand global crisis. We remain committed to ensuring that NTD efforts continue no matter how big and stubborn the obstacles are. These are the videos of our YouTube series, Don't Get Bitten. They cover diseases that are infected by insects and worms such as dengue fever, rabies, soil-transmitted helminthiasis, and more. Check out our YouTube channel Healthyi for more information. These are the 4 organizations that are collaborating with us to complete our mission to fight against NTDs. One Tribe initiative creates environments where individuals and communities can truly thrive by developing economy, education, health, and nutrition. Founded in 1997, Medasar is a Medical Students Association of Rwanda. As a non-profit, independent, and non-governmental organization of medical students of Rwanda, it has worked with Healthyi in 2024 at Rwanda and successfully completed a mission to educate about bilharzia. With Kaduna State Government, Healthyi has completed a project called Community Sensitization on Soil-Transmitted Helminthiasis and Deworming of Children in 2023. This is a report addressing the result of the Awareness Campaign Survey. One of the most crucial results from the survey is the significant lack of awareness about NTDs. A staggering 82.8% of respondents admitted they didn't know what NTDs are, and only 23.3% could correctly identify the acronym. When asked about the global impact, over 80% underestimated how many people are affected, with just 18.1% accurately recognizing that NTDs impact more than 1 billion people worldwide. Furthermore, only 29.3% of respondents correctly estimated the annual death toll caused by these diseases. These numbers highlight a major knowledge gap that must be addressed. Interestingly, while awareness of NTDs was low, respondents showed a stronger understanding of other health-related topics. Additionally, knowledge of the Sustainable Development Goals, aka SDGs, was relatively high. Over half of the respondents were aware of the SDGs, and about 40% even knew the number of goals within the framework. More than 80% were able to correctly identify the SDG that includes NTDs. This contrast highlights the need to bring NTDs into mainstream health discussions, just as other well-known diseases are. This survey proves that the lack of awareness about NTDs is not just a local issue, it's a global challenge. The results emphasize the need for educational initiatives to close this gap. Based on the results, we could address that though NTD is a global problem, not many people are aware of what it is and how it is important to combat it. And the need for educational initiatives to close the gap is crucial. This is it for today, and thank you everyone who joined our journey today. NTDs continue to impact millions of lives, especially in the world's most vulnerable communities. But together, we can change that. Through awareness, collaboration, and compassion, we can break the cycle of neglect and bring health, hope, and opportunity to those who need it most. Follow us on Instagram and YouTube channel for additional information, and feel free to reach us whenever you have questions or would like to join us. Thank you.